So kidney cancer in and of itself is a relatively rare disease. It represents about 3% of all cancers. Each year there is somewhere on the order of around 45 to 50,000 cases diagnosed. Even within renal cell, this relatively niche disease, there are rare subsets, and that happens to be one of my areas of research interest. Specifically, about 10 to 15% of patients are classified as having papillary renal cell carcinoma. About 5% of patients are noted to have chromophobe subtypes of renal cell carcinoma. And about 1% of folks have an exquisitely rare subtype called collecting duct or renal medullary carcinoma. This year at ASCO, I'm presenting some data related to genetic profiling of patients with collecting duct renal cell carcinoma. What's quite interesting is that the paradigm for this disease has been very different. We've typically approached it with chemotherapy, whereas for other types of renal cell carcinoma, we're using targeted agents. Some of our data points towards unique genetic alterations that may potentially suggest treatment options for patients with this rare and aggressive disease type.